There are a few things that you have to know. That's what we're going to cover today. Just the facts, the basic fundamentals that you need to know to produce a high quality image to get the answers that you need to take care of your patients effectively.
So how about the Achilles? Okay. Well, the Achilles tendon is best examined with the patient prone. You want their feet hanging off the bed. This example, we have just gel that's being used, just a thick layer of gel that's being used to bring the Achilles tendon down to our imaging plane.
Where if you put the transducer over the abnormality, you draw an X, you remove that, and you clean the area and just put the needle straight in perpendicular where the transducer was to the depth that's predetermined based on the ultrasound image. That's the indirect approach. That I use only on occasion when I have a very large target.
Again, what you want to do is place the probe right in that area of the inguinal crease, okay? And the next thing we want to identify is medial and lateral. So lateral is over here, screen left, medial, screen right, okay?
You can get really good at this. This is a median nerve. There's the artery and there's our vein. And we have, these are millimeter markers, so we got like 1.5 millimeters space between the two.
Somebody who's like this, a 42-year-old male, who comes in with 1 hour of chest pain, he's diaphoretic, and he really sounds like he might be having the big one to me, okay? Especially when his EKG does not meet the criteria for acute MI so that I can send him immediately to the cath lab.
Both of these are interscaling nerve blocks, okay? The image on the left is a very aggressive injection, whereas the image on the right is a less aggressive. Both blocks worked, and they worked well. Here comes the needle in. First of all, the needle's being advanced, and you don't have the best visualization of it. In this region, you should really be able to see it well. And it's really poking at the nerve when you can't really see it. It's being advanced right into the nerve.
So the first image of the shoulder protocol is the long head of the biceps with the probe in a transverse or short axis orientation.
Well, there it is, right? Echogenic, coming through the soft tissue, into the muscle area that we see here in the thenar eminence, the hand, extending down. So it was very readily visualized on ultrasound, where it could not at all be detected on the X-ray, and it was easily removed by the treating physician after identification on ultrasound.